All right, good evening, everybody. I'd like to call to order the Macomb County Community Mental Health Full Board Meeting for November 21st, 2023. Please rise for the pledge. Next, we will have the reading of the mission statement from Donna.
Okay. Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Donna. Next,
Welcome.
we'll move on to item 3, adoption of the agenda. I'll take a motion to adopt.
So moved. Support.
Motion from Megan, support from Lori. Comments, questions on the agenda? Any changes? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? The agenda is adopted. Next, we'll move on to item 4, hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Come on up to the microphone, give us your name. Start whenever you're ready.
Hi, my name is Tatiana Tina Savage. I am a Macomb County Community Mental Health Provider. I am the owner of Quality Care Rehab and Autism Clinic, proudly serving the community. This is our 10th year providing services of physical, occupational, speech therapy, and applied behavior analysis. I feel very privileged to be here. I want to thank everyone for the partnership. I would like to express as a provider on behalf of my other providers that I am friends with, it's been a very challenging year for us. As small business owners, we have really been anticipating rate increases this year, and we were thinking that on October the 1st that we would have our new fee schedule. To put it in perspective, our labor costs have significantly increased, so finding a physical, occupational, or speech therapist to work in the community with children and adults who have special needs and developmental disabilities, the cost has increased. We, as a provider in Macomb County, also provided in-home therapy services to people that were homebound or to families that had children that were in wheelchairs, and it was difficult for those kids to get into the clinic. My clinic provided 6,500 in-home visits last year, and we did that at a loss to my organization. We are a for-profit clinic, and again, I feel very privileged. I have a wonderful group of therapy providers and a team of administrative professionals that schedule thousands of appointments. We did about 20,000 appointments last year. We had a 15% cancellation rate. I made the executive decision to pay my team $10 cancellation fees within less than 24 hours because it was a burden, and I had people resigning when they would show up at a home, or they would be waiting in the clinic to provide therapeutic services, and families would be no calls, no shows. So we have really worked very hard to be a good provider and a good community partner. Unfortunately, we were very surprised as providers when on October the 1st, we did not have a fee schedule, and we were presented with this fee schedule, and it was a 10% rate reduction. I had to, fortunately, again, I'm very blessed to be here, and I thank you all. We did apply for a stability grant, and I thank Dave and the team for approving that because the company was running at a loss while we were anticipating increases in CPT codes, which is how we get paid, and we did not have that. Instead, we were all surprised with a 10% proposed rate reduction. Myself and my fellow providers in the community that provide these very, very medically necessary services to families and children who have developmental disabilities and special needs, we're all shocked. We were contemplating, do we shut our doors down? Are we going to be able to afford to provide these services to kids and families in the community? It's been a very distressing year. I just would like to say that I think the communication could have been improved. It would have been to everyone's advantage to understand and know well in advance that the rates were going to be cut 10%. And I wanted to bring that to everyone's attention. I do feel that we could have receive that notification at least 3 months in advance so that we could budget as small business owners. And I would like to say many of my colleagues that are not here tonight could not be here, but I have spoken with them, and many of us are female-owned business owners. We're small business, and this was a real big shock and surprise to us. So I just would like to bring that to everyone's attention. I'm hoping that the communication can be improved in the future. I do appreciate that the CFO, Tony, was in a meeting with my administrative director and myself, as well as the administrator of OTPT, ABA, and speech therapy services last week. And I think he had a better understanding of what we do. And I think that the CFO attending some of these meetings is beneficial. And I would really advocate for that in the future, Tony. I think it was helpful for us. So I really do appreciate that. And I would just like to bring that to everyone's attention that we as small business providers, we're providing really needed services, and we are not getting these commercial insurance rates for these services. And it's very challenging to provide the services and having timely communication so that we can collaborate together and come to a consensus and an agreement instead of being surprised in the last minute would be very, very helpful. And I appreciate the opportunity and look forward to being a good community provider in the future. Thank you.
Thank you. Thank you for your comments. Anyone else from the public wish to speak? Anyone else? All right, I will close the first hearing of the public. There is another hearing of the public before the end of the meeting, and I will move on to item 5, approval of the minutes of the regular meeting of the CMH full board held on Wednesday, October 25th. Take a motion to approve.
Support.
Motion from Donna, support from Antoinette. Any changes, comments? Hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are adopted. Item 6, approval of standing committee meeting minutes and recommendations. We did not have a program and budget committee meeting this month, so we will skip that item and we'll move on to item 7, which is request to approve. Item A, I'll take a motion to approve a contract from TBD Solutions, state of work number 2, which has been approved by legal.
So moved. Support.
Motion from Antoinette, support from Megan. Dave, you're up.
Thank you. TBD Solutions has been working with us in a consultant role for the Crisis and Receiving Stabilization Unit. They've been great partners. They've been at the statewide meetings. The state continues to tweak, develop, finalize, work to finalize the standards in this area. And because of the where the state is on their timeline, it's been extended. We're just asking to extend the TBD statement of work, the agreement with them through next fiscal year. It's still very much a moving target, a hot topic, an important area for us, and we are benefiting from their collaboration with us. They've also been helping us with the RFP process for this area, and then policies and procedures, a number of really key areas. So I do recommend we extend.
Thank you, Dave. Any questions? Nick?
Just on both this and the next one, I've noticed that they were again missing the county exec signature lines. I don't know if they need, I think the second one does need it. This one, I don't know whether it needs it or not.
It'll be amended, yeah.
Pardon me?
It'll be amended and it'll go over to Al for signature.
Any other questions? Okay, hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? Motion passes. Next, we'll move on to item 7B. Take a motion to approve RPC engagement letter compliance audit in the amount of $25,000. This has been approved by legal as well.
So moved. Support.
Motion from Antoinette, support from Lori. This is like our Board of Commissioners meeting when Antoinette and I were making all the motions. Ken, go ahead.
Good evening, everyone. This is a renewal of our contract with our compliance auditors. Just to remind everyone, our compliance audit with the state of Michigan contracts is separate from our financial statement audit. The county, because we're a fund of the county, hires UHY to do our financial statements, and we do the compliance audit separately. So this is the same thing as last year, same price, different year. Not any significant changes, but happy to answer any questions.
Thanks,
All right.
Ken. Any questions? Okay, hearing and seeing none. All in favor, say aye. Aye. All opposed? Motion passes. Thanks, Ken. Next is item 7C. Take a motion to approve COVID substance use and gambling services fiscal year 2024 amendment, which is no change in the budget total.
So moved. Support.
Motion from Megan, support from Lori. Dave?
Helen did a great job summarizing it on the board action request. As Phil indicated, there is no change in the overall budget. This was simply an adjustment of funds between line items in the existing agreement, from the treatment budget to the prevention budget.
Thanks, Dave. Any questions or comments? Okay, hearing and seeing none. All in favor, say aye. Aye. All opposed? Motion passes. Next is item 7D, and take a motion to approve sponsorship at 2024 Kevin Song Annual Conference on Suicide in School Summit in the amount of $10,000.
Support.
Motion from Donna, I believe, and support from Megan. Dave?
You have a handout in front of you. I attended the conference last year, and it was my first exposure to Kevin's song. I was actually part of a panel discussion with Selena, so unfortunately she's not here. They do a great job of putting on a suicide prevention awareness informational conference. We have this opportunity to become the primary sponsor, and we get staff attendance. We will have a table there and a strong presence to share information about what we're doing. We are also, as you're aware, working on a zero suicide program. So this is all within that wheelhouse, and it's a really interesting opportunity, maybe to overshare and put Ken on the spot. Ken and I have a good relationship where I'm like, can we sponsor this? And he's like, no. 9 times out of 10, he just says no. We've whittled it down to anything that's fun is a no. This one is very much informational. We will have the table and the presence, and it's those types of activities that we are able to fund because it's part of our community outreach efforts. And like I said, this ties to a number of the other initiatives that we're working on. So I would recommend that we do the key sponsorship for this event, and then we'd be happy to report less of that next year.
Thanks, Dave. Any questions on this item, comments? Okay, seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next, we'll move on to item 8, receive and file. I will take a motion to receive and file the CMH September advertising campaigns report.
So moved.
Motion from Antoinette,
Support.
support from Nick. Tracy, go ahead.
You're going to start receiving monthly reports similar to this one. If you did read it, I'll try to explain it in plain language because that's what I asked them for. After I read it, there was some confusing marketing jargon, right? So essentially, if you summarize it, these campaigns that we did for both suicide prevention and SUD reached about 4 million people during the month that they were open. That's including the billboards, radio, and social media. The most successful, believe it or not, was actually forgive me, it was one of the social media ones, had the most success out of total numbers and percentage of conversions or the interest kind of shown. It increased our visits to our website in that 30-day period by 14,000. Yeah, so it's huge. So we're happy with the success it's had, especially with a quick turnaround. So we look forward to continuing this type of approach in the future when we do very specific targeted campaigns on specific subjects. And I'm happy to answer any questions if there is something specific.
Thank you, Tracy. Are there questions or comments for Tracy right now? Not, can always email her too. But thank you for the presentation and the report. Appreciate it. And looking forward to the monthly updates. All right, seeing no other questions or comments, we have a motion to receive and file. All in favor, say aye. Aye. All opposed? Motion passes. All right, item 9 is resolutions. We don't have any resolutions, however, I get to sneak this in because I'm the chair. From the county of Macomb and Executive Mark Hackle, Dave is getting a 5-year service certificate, and I want to present that to him.
Thank you. It's been a fun 5 years.
Wish we had you for 5 more. And yes, I left my mic on intentionally for that. Next, we'll move on to item 10, the voucher listings. I'll take a motion to approve paying the bills.
Support paying.
Motion from Donna, support from Mark. Questions, comments on the bills? All right, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. The bills are paid. We'll move on to the CFO update with Ken.
Good evening again. I figured I'd start heading up during the voucher question because there was one. I'd probably have to answer that as well. So I'm going to go through, I'm not going to belabor the financial statements too much this month, but I do want to highlight some of our tentative year-end numbers. So we submitted our interim FSR. It was due on November the 10th, and we submitted it on time. So again, these numbers are temporary. We're still waiting for claims to run out and things that have until November the 30th. So I wanted to give this group an idea of where we stand with those numbers currently. So I did a little comparison to prior year. Last year, our Medicaid and Healthy Michigan lapse was roughly $25 million. This year, we're down to $6 million. There's a couple reasons for that. One, we had a full year recognition of our rate increases that we put into our provider network to support that group. The other thing is the CCBHC program as that grows. So in maybe simplifying it, but the more, when we have a service that's CCBHC related, the base portion of our PPS 1 rate is subtracted from our Medicaid and Healthy Michigan revenue, and it's moved over to CCBHC. This year, the state calculated our base portion of our PPS 1 rate to be 100% of the total PPS 1 rate. It's somewhat unusual, but that's the way our math worked out, and really, for us, it wasn't an issue to have it that way. We can imagine that we're subtracting more dollars over here, and we're putting them into the CCBHC program, which is a nice financial benefit. So on the CCBHC side, we're predicting a roughly $12 million receivable, actually, from the state of Michigan, where they're going to have to give us some money back for that program, partially because as I mentioned, the supplemental portion of our rate, which is the other side, not the base, but the other side, is 0. So everyone that's mild to moderate, they owe us for. And that's all fine from a financial perspective. Our GF labs went down from 3.8 million last year to 1.5 million this year. A big piece of that is our CCBHC program again. The more non-Medicaid folks that we see, the more it's going to take away from our GF labs, which again, that's part of the program. We're supporting that group, and it's expected. We also discussed a 236 transfer at this group, so that was part of that as well. So trying to use those GF dollars in the community wherever we can and not give them back to the state of Michigan. So this year, just to remind the board, we'll have more ramp up with spend down with the PHE ending. So some of that's probably going to level off, and we should be even closer to 0, I would expect. Our ISF ending balance, I think we put roughly $6 million in the ISF this year. That's what we're predicting. That's supported by an actuarial analysis. And then our Medicaid savings will be almost $20 million, which is an increase from last year as well. And that's just a direct result of our revenue being higher than it was the previous year. So it's a straight percentage of that. So, financial good news for year end. I think fiscal 24, there's some, as we've discussed, some question marks, but fiscal 23 looks good. Any questions about that piece before I go any further?
Nick, go ahead.
Just one question on the CCBHC program. Are we billing third-party payers? I mean, I think
Yes.
we can, so if a person has insurance.
Yep.
How's that reported?
It's reported as it's net against our CCBHC revenue. So we subtract that off because we received it so it's, compared to the CCBHC program as a whole, it's very small. But we bill not only our staff to third parties, but any of our DCO partners in the community, we bill their staff on their behalf to third parties. That's just the way the program's set up. So as the program increases, our third-party billing increases as well.
Will 4707, the House bill that would provide for parity in state law akin to what's required in the ACA, should that help?
I would have to look at that, Nick. I'm not sure what the,
Okay, we've talked about that.
okay. Any other questions?
Doesn't look like it.
All right. I will segue into our open items that I touch base on every meeting. The ISF that I just mentioned, there's an open question related to that. We have an FSR work group next week, so I expect that to be a topic of discussion. And I will have an update at some later date. The MAT rate, that continues to be a question mark unless Dave has updated information that I am off this week, so I might have missed something, but.
There we go. The MAT is the medication assisted treatment. The legislators passed that the rate for that should be $19 a service.
Right.
We had been paying historically closer to $5. Richard is on record that, the way it came out was inappropriate. It did not come down through the department. It did not come down through the contracting process, and that it is not in keeping with the general accounting principles. Region 10 has a legal opinion supporting that. I have talked to Kristen Jordan at the department. She was going to follow up with some written guidance to support us paying that back to October when the legislators passed that. I have not received that. I did check my emails later in the afternoon today. Richard did today send an email to Kristen asking for some guidance. So the ball's in the department's court right now. The other 7 PIHPs have implemented and dispersed those funds, but Region 10 and Macomb have yet to implement that. So we're waiting for clarification on the very specific detailed questions that Richard has put on the table, and haven't gotten any guidance yet.
Pretty much all these, the third issue as well. Richard has sent an email asking for guidance, and we need to hear a response. The My Health Link state inpatient being the third issue that we haven't heard anything on in some time. So the last update I had was, I think everyone, the recipient rights budget meeting, we had a question about in that meeting. So I figured I would give an update at this group that we did have some positions that we needed to reclass as part of that conversation, but it doesn't change the budget presentation at all. It will be a detailed change in our system, but I think that's kind of what we talked about there, but confirm that as well. Going to the financial statements, page 2, I'll just highlight that revenue and eligibles are trending down slightly as expected with the end of the PHE. The subsequent there isn't anything much on any of the subsequent pages that I haven't already covered as part of our year-end numbers. So there is a negative number on page 8, $28 million in the first column there represents our savings and our lapse calculation. So again, that ties back into what I had for year end. If there are any specific questions about the financials, I'll answer them, but
Don't see any.
all right.
Thank you, Ken.
Thanks, everyone. Have a great Thanksgiving.
Thank you, you too. Yep. And with that, we'll move on to the CEO update.
Good evening. A couple of quick updates. I wanted to thank Lori. We attended a health fair at the Trinity Church in Utica. The attendance was not exactly what they expected, but the people we were able to talk to was very impactful. And it's those, we've dramatically increased our presence in the community, and we continue to do that. We're getting good staff participation and stuff too, and we're working to grow that. Tracy, we hired our new marketing supervisor.
Her name is Kayla Collins. We'll invite her to a future meeting, but this is day 2 for her.
Day
And
2
it's
for her, yes.
Day 2.
She will be our point person with Airfoil as we continue to improve our marketing and expand it. On that note too, I did an interview with Middle Eastern America Television. They're very well connected to the Middle Eastern communities on all sides. I haven't seen it yet, so we'll see how that came out. But they also have a very strong social media presence. And then today I did reach out to Airfoil to connect with MEA TV so we can continue a campaign in that area as well. Also this morning from our Citizens Advisory Committee, Linda's not here, but we do have a new member that Linda will be bringing forward to the board for official approval. But Agnes Ward will be following up with James Friedman to start our connections, expanding our connections to the faith-based communities locally. And that'll be an ongoing effort through 2024 as well. But it's, I'm sorry for not starting that earlier. It's been on my radar, and we've done a little bit here and there, but we definitely need to grow that connection. Same we do with the first responders. There's some critical incident training coming up with the police that James Friedman is involved with. Agnes was involved with previously. We do, through the opioid settlement dollars, there'll be some money for the CIT training for police departments, and we're able to assist in that area as well as part of our community outreach and training efforts. I am working on a summary of all of the various projects that we have going on. I started it today. I do have some time on my schedule tomorrow, so I might be able to get it out then to the board here. Trying to summarize, not just list the various projects, but keep them in context. There was a method to my madness at all times about the areas that we're focusing on and working on. Of course, it's your call what continues going forward, but I wanted to make sure that I gave you as much information as possible. So that will serve as my board report in writing, but actively being worked on. So, thank you.
Thanks, Dave. Any comments or questions for Dave?
Good.
Good, no, okay. We'll move on to Thomas's presentation, the ITIS department.
Hi, everybody. Back again for the third month in a row. I also noticed that the zip code's wrong on there, so everything else in this presentation is a lie.
So you're gonna end it now?
Yeah, so I've started to classify our two departments as the information services infrastructure overall kind of department there. Didn't really have a name, but that seemed appropriate. And so that, I mean, that's the first thing to say is that they are two separate departments. A lot of times they kind of get lumped together, but they serve very different functions, and we'll go into that during this presentation. So some of those functions here are staff support, technical budget and contracting, system security, service platform management, communication systems, physical infrastructure, mobile device management, business continuity, customer service-based initiatives, and data integrity. Feel free to stop me at any time if you have questions. These are the folks that we have in our departments here. So there's myself, and then under me is Carolyn Landy on the IS side, and she's our IS system administrator. Dan Gill, who's in the room and you guys met last month, is our IT system administrator, and underneath Carolyn we have Alan, who is our IS coordinator and then entails help desk and our BH Ted's reporting to the state, and he works on quite a few other things. Underneath Dan we have Brent Ward, Josh Hurley, Sean Stager, who's a relatively new hire, and Pat Mosher, who's been with us for a long time. And then we also onboarded an office assistant this year, Angela. So let me go ahead. So MCCMH IT and IS support a wide array of services across MCCMH direct sites and assist with technical support and guidance for our contracted agencies. We're uniquely situated within the organization as we work with and support staff across all our locations. Both departments are customer service oriented first and technical second. Function areas are split across providing support and developing and implementing solutions. So we have people in the departments that do both, some that are working on more technical things, other people that are situated to provide more assistance to end users. And that may rotate on a weekly basis, depending on what projects are going on. Information Services Leadership participates in the statewide CIO forum to collaborate on state and national requirements, along with developing resolutions to shared issues amongst the PIHPs. Some of the department highlights, I know this is a pretty lengthy slide, but we do a lot of things and we're proud of them. So we moved the workforce to remote overnight in March 2020. During the onset of the COVID pandemic, set up dedicated telepsychiatry offices across all MCCMH clinics as part of that. Implemented a zero-touch deployment model. If we need to provide somebody with equipment and they're unable to come into the office for some reason, we're able to do that. Migrated our primary data center to our new administration building with the incorrect zip code. With zero downtime for our call centers, so we were able to seamlessly fail over to our redundant location and then fail back, and not miss any crisis phone calls or anything, which is a great thing. Assisted in the reduction of call center hold times and provided ongoing monitoring in that area. Improved our EMR project management and streamlined the request process for adding features to the EMR, along with adding additional transparency to that process because it was kind of obscure for a lot of people for a while, knowing how to get things into that system. Implemented a generic authorization process to gain some understanding of recipients that we have waiting for services. Reduced initial response time for IT help desk tickets from 5 hours to 2.5 hours with increased staffing and improved documentation. We distributed Dragon Medical One dictation software to doctors to assist with documentation activities. Led the migration to collaborative workplace software, Teams, Microsoft Planner, etc., to improve information sharing and project planning. and updated our website utilizing new branding and design language. And, also made it so if there's 17,000 new visitors or 14,000 new visitors, that it doesn't collapse under the weight of that. Staff support is one of our function areas. That's the most visible component of both departments. So if, you're a average staff, you're gonna see that part. You might not see all of the other stuff going on behind the scenes. Our staff require assistance and maintenance for hardware and software that they're using every day. They submit tickets through 2 help desk systems. They're separate for the IT and IS departments. One exists within our medical record system, and then the other is independent. And we actually use the same thing that the county does, Fresh Service or Fresh Desk, for that. We take pride in our prompt responses and thoroughly resolving issues, and then hopefully providing staff with the tools that they need in order to, resolve that issue themselves the next time if possible. Just some numbers, we average roughly 300 tickets a month on the IT side. In 2021, we resolved 3,175 tickets. In 2022, we resolved 3,146 tickets. And about 60% of tickets are resolved on first contact with the requester. So that means they submitted the ticket and then we reached out to them and that was the resolution. It was closed after that. So pretty good ratio. And just a fun fact is that the highest number of tickets are submitted in January upon return from the winter holiday, and that's consistent year over year over year. So you have a dip in December and the end of November for people going off for holidays, and then they forget how to use their computer, and they come back in January, and we get an influx of tickets, and it's to the tune of like 200, 300 more tickets than any other month. All right. System security. Obviously, we handle sensitive healthcare data because we work in healthcare. IT and IS staff approach all projects from a security first perspective. So, we provide customer service, but when we're looking at actually implementing solutions, we look at it security first. This can include things like email filtering and encryption, multi-factor authentication and conditional access policies. So, depending on a certain set of scenarios, like you are or are not granted access to something, that could be something like location or, IP address, that sort of thing. Access control and monitoring, firewalls, VPN, and application proxy for providing access to things outside the network for people that are not in one of our buildings. Incident reporting and response, and backups and replicas. Technical budget and contracting. IT services require careful planning and budget. We work in collaboration with all of our departments to forecast needs, plans, and budget accordingly. We consider it the cornerstone of our year-over-year enhancements. So we try to account and somewhat predict the future, and try to account for that in budgeting. And that's where we get these, kind of big year-over-year changes. We operate based on an open door, any project considered model. So if you think that you have something that's in need of a technical solution, we'll either, we'll hear you out. We might tell you that it's not a technical need and that maybe we'll provide some guidance to drive it to be something maybe that's more, data driven, or into another area entirely. So because we interface with all the departments, we tend to, be able to kind of steer something in the right direction if it's not strictly technical. And then some overhead is left in our budgeting to cover emergent needs. So we're not always great at predicting the future, so we need to leave a little bit of room in there in case we don't. Service platform management. We maintain several service platforms across both departments. That includes things like our Microsoft 365 for all that collaboration and email. Our Focus medical record system, Tableau for our reporting, web servers to maintain our public web presence, and more. The Focus medical record is the largest and most complex service platform we manage, and the primary responsibility of IS is to improve the electronic medical record system by coordinating projects related to the constantly changing needs and different functional areas that touches. Our communication systems, MCCMH operates two 24/7, 365 call centers. Ensuring uptime and stability for the call centers is a central responsibility in IT. It's like when Sean got onboarded, we kind of told him, if nothing else, the phone systems must stay up. Like that's the front door for everybody. So when we were approaching moving our administration building, that was the first thing that we thought of when we're doing any planning on major system overhauls. We have to consider the call centers first. We maintain and support the ability to collect comprehensive reporting from those communication systems, which is used to improve call center operations. So that gets pulled right into the work that informatics is doing and is used to run comparative reports and that sort of thing. So important that we collect that information and leave that running as well. Our physical infrastructure, we maintain local infrastructure to support the phone systems and provide internet connectivity to our locations. We also maintain site-to-site connectivity across all of our locations, and we consider ourselves usually a critical extension of the facilities and operations group, and IT gets involved from the ground up in any expansions or moves that we're planning, along with that can include moving into a building, but it can also include moving out of a building. Mobile device management. Our staff are increasingly mobile, and IT has to manage their devices wherever they go. We have the capability to wipe and reconfigure devices remotely with no hands on the devices, and any device that we deploy receives a consistent baseline configuration, which makes our troubleshooting more efficient and the documentation that we provide to people more broadly applicable. Business continuity, very important. We operationalize and plan for outages and equipment failures. The sensitivity and always-on nature of our operations requires immediate action during these events. And our goal is to restore systems to as close as to the state they were at the time of the outage as possible with little or no downtime. So you might, if you're ever hearing people talk about business continuity, you might hear terms like RTO, return time objective, or RPO, return point objective, and we try to keep that as close to real time and the return time as low as possible. Customer service-based initiatives, we create new projects and initiatives centered around support activities. So if somebody submits a support ticket, a lot of times that's where those projects end up being born out of. We'll have an issue that's coming in consistently, and then we end up, Dan and I or Carolyn and I will sit down and we'll be like, there's a better way to solve this. We can put something in place where we never get this problem coming through the help desk again. So a lot of times it's born out of those, customer service-based initiatives. That also can be activities focused on improving efficiency and convenience for staff, and assistance in automating repetitive or tedious tasks, which is, I think Dan would agree with me, is like one of our favorite things to do. We see that as kind of our reason to be, is, somebody is doing something the slow, tedious way. If we can, help save them time, like that's great for us, and we feel really good at the end of that interaction. Data integrity. It's important that what goes in one place comes out the same somewhere else. Data integrity utilizes monitoring and integrates security to ensure information is not tampered with or corrupted. That extends to things like access control, ensuring that modifications cannot be made by staff not intended to have access to a file or document. It touches a lot of areas, but those are kind of the high-level bits of data integrity there. As far as the future goes, some of the immediate things that we're looking at is migrating our communication and telephone systems to offsite and cloud-based hosting. As I said, when we moved facilities, we failed over to the solution that we already have in place that the board had approved a couple of years back for us to have our redundancy hosted offsite, and realize, we could potentially run the systems like that all the time. And then Dan doesn't have to be woken up in the middle of the night because there was a power outage, because I remember how fun that was. Updating and refining policy and procedures and developing comprehensive documentation in an IT handbook. So just really, you know, we have a lot of internal procedures to the IT department that could be written into broader documentation. Now that we have some extra staff, we can devote people to, you know, disseminating more of that information out to staff and kind of having, you know, rules of engagement there. Roll out emergency notification system across all of our sites that integrates with our primary communication systems. We're actually just discussing this with Bruce. When right before this meeting started. So we've been working on for a while coming up with some kind of solution for a system that would. We've had various sites ask about having a notification system for emergencies, and what we didn't want to do is roll one out for one site. We wanted to roll it out for all of the sites because it's too important to just put in one place, and then it's just like, well, those people are safe, but all of those other people have to wait. So we were not super in favor of doing it that way. So we do have a solution that we're working on finalizing the numbers on, and again, I think we will probably be coming back here to talk to you about it as well. So looking forward to that. Adding contract staff to maintain existing web applications website and potentially developing new internal web applications. As some in this room might recall, that's kind of what I started here doing, and we don't really have staff that are doing that anymore. So we're looking at different ways of, you know, either contracting with an agency out there to do that, or potentially adding some contract positions if possible in the future to help maintain that stuff, because a lot of that still falls on me, for better or worse. Further improve turnaround time on medical record enhancements. Like I said, we've made some improvements to the overall project management in that area, but I still think, you know, given our limited staff, we can come up with some more creative solutions for moving things through that process faster and prioritizing things. When I stepped in, there was no such thing as a due date. The things were pretty loosely organized, and now we've organized everything around due dates. We basically make it very clear that if there's not a due date attached to something, it's just there. So that was a very surprising thing to me, but I think we can continue to kind of work in that area. And then developing enhanced approval process for projects both in IT and IS. And so we've kicked around the idea of having, you know, kind of a lot of that approval lives with myself or Dan, and maybe just having kind of one more set of eyes on that thing to basically make sure that this is kind of where we want to go as an organization, and, you know, limit the number of things that come in, because, you know, it's somewhat difficult to expand staff around here sometimes. So thank you, and I appreciate your time, and if you have any questions, you can ask me now or email me.
Thank you, Thomas, for the presentation.
Thank
Dave,
you.
do you want to start? You want to go to we'll go to Donna first.
Let me see if I can get this. I know the county has kind of a large IT department, and I was wondering if you ever work with them, or if anything that you do kind of overlaps with that department.
Yeah, so that's kind of interesting. I have worked with JACO quite a bit in the past, and we've primarily been focused in areas of information security and how that flows between the two, because up until this point, and I know that's changing, it seems that you know, you guys have been, or the county has been on Google Workspace, we've been on 365. We haven't really had a lot of overlap in the way that we do things and the systems that we're using, and that seems to be emerging a little bit more. So I do see in the future probably us working with them more heavily and seeing areas where we can benefit from each other's expertise. But yeah, there's always kind of an open line of communication if they're doing something big, if we're doing something big. I know with all the Workday stuff, Tracy and Gail and Amber have been working with the county pretty heavily in that area, and that does overlap with IT. So yeah, there is always some back and forth communication there. Yep.
Thanks, Donna. Dave?
I wanted to thank Thomas and his team. They do more than even everything that was presented. You've seen presentations from other departments using this format. This is our bubble project, and this was a brainchild of Tracy. But it has our core values there. It came out of a conversation at leadership. There was some disagreement, But my point was, everything that we do is to impact and support the people that we serve in the community. Thomas's presentation stressed heavily that they support our staff, and then, of course, our staff are the ones who are, face-to-face and, or remote, working with the people that we serve. But Thomas and his team really get it, and they understand. You would think perhaps that all of this technology and everything, that they're really far removed from the people that we support. It's not true. Thomas understands and his team understand that if the phone system goes down, that's somebody who's not able to call us in an emergency. If a staff or if a doctor can't log in to the telepsychiatry system, that's somebody who's not getting that service and stuff. So I just wanted to compliment Thomas and his team that for Tracy for getting us this format. But Thomas's department is a great example. Again, you would think technology, you guys are in the back offices, not interacting with the people we serve. Not true at all. They're having a direct impact on a daily basis on our ability to provide these services and to keep them going, and then to track and do all of the reporting on that too. So
It's
thank
very
you.
kind. Thank
Thank
you.
you and your
And then,
team.
yeah, we make that a part of our philosophy. Like, I try to communicate that kind of day one. Told Dan that when he started. I told Sean that when he started. So I'm glad that that's seen.
It's very much so. Thank
I
you.
appreciate it.
Thank you. Thomas, real quick, before you run off, the county's putting a heavy emphasis on a cybersecurity audit going into next year and probably beyond. Is that something that we currently do, would plan to do? Would we do that in concert with the county, or is that something that we would do separately? Do you know the answer to any of those questions?
Am I allowed to embarrass you?
Please.
I was here. I was here last month.
That's
getting the
right.
contract
That's
approved
right.
with
As soon
OSC.
as you said that, I'm like, wait a minute. Because we were talking about this when we were just doing our amendments yesterday for the Board of Commissioners, and it's
So
like,
thank you, Phil.
you're welcome.
We are working closely on this.
I haven't even had any turkey yet, and I'm already there. Forget that question. Thank you, Thomas. I know. The future. Thank you, Thomas.
Crystal ball.
Any other questions? No? Good. All right.
Thank
Thank
you.
you, Thomas. All right, with that, we'll move on to a couple reminders. We do have a program and budget committee planned for December 13th here at 6 p.m. Recipient rights is planned for Thursday, December 21st at the administration building at 8 a.m. And our full board for December will be on the 27th here at 6 p.m. Are there any other board members that have anything to add? Please don't bring up anything that we approved a half hour ago. Lots happened since then, Dave. All right, with that, we will move on to the final hearing of the public. Anybody from the public wishing to speak? Come on up, you have 5 minutes. Anybody from the public? All right, seeing nobody jump up, we will close the hearing of the public. I want to wish you all a safe and happy Thanksgiving. And I'll take a motion to adjourn.
Support.
All in favor? Aye. We are adjourned. Thank you, everybody.